all be out within the next week or so. And let's see, we have Juliet McCoy coming on from Molina Healthcare. There we go, Andrea Beltran, thank you. Nice to have you all here. We do have a little presentation to share with you. There'll be time for a question and answer. As I said, we have folks on from Health Care Authority and from the MCOs. And so there will be time for you to ask questions of them as well, but we're hoping to get a lot of your questions answered ahead of time. So without further ado, I'm gonna go ahead and start sharing my screen and jumping right on into the presentation. Please give me 1 second. And I'm gonna go ahead and stop my video while I'm presenting, just for the bandwidth purposes. Okay, so here we go. So today we are here to talk about doula certification for Medicaid reimbursement. This is the second presentation or conversation that we've had this year. And I'm really excited because we've had a lot of really great and new updates for the program. What I'll ask is that if you have questions during the presentation, if you wouldn't mind just hanging on to them. Like I said, we will have time at the end to answer all your questions. If for any reason my audio is getting shifty or if you're unable to hear me, feel free to unmute and just let me know because I can't always read the chat while I'm presenting. So for those of you who are just joining us, I invite you to introduce yourself in the chat. Please add your name and pronouns, location, what kind of doula work you provide, or what other doula or what other work you do to support doula work in the state of New Mexico and beyond. And I invite everybody just to take a minute to kind of look through the chat and see who's here with us. As I said, we've got quite a crowd here today. It's an amazing group of people who are providing care all over the state. You might have seen some of these slides before in our last presentation, but I did want to kind of bring them up for those of you who are seeing all of this for the first time. This is just a list of folks who were involved in getting the doula Medicaid reimbursement benefit up and running. So, you know, back from the very first conversation I had with the folks over at Table Women United and the people with, at the time, they were Young Women United, now they're Bold Futures, and Breath of My Heart Birthplace. We began these conversations back in 2015. And for the last 10 years, it has shifted and shaped and molded and, you know, come to be with the added support, with the added work, advocacy, all sorts of amazing work being done by all sorts of folks all across the state. So we know that there's lots of people on this list that we have missed, but hopefully you can see all the people, the voices who have come together to make sure that doulas are able to receive Medicaid reimbursement here in the state of New Mexico. Now, many of you already know what a doula is, but for those of you who this is all brand new, we want to say that a doula is a trained non-medical professional who provides services which include health education, advocacy, or physical, emotional, and social support to a person during their preconception period, pregnancy, childbirth, or postpartum period. There's lots of benefits to doula care, which includes lower rates of cesarean births, higher lactation rates. We know that doulas also help to reduce the impacts of racism and racial bias, and that they often provide tailored, culturally appropriate, and client-centered care and advocacy. Across the nation, for the last, 10 years or so, even a little longer, there has been a movement and a momentum to get doulas Medicaid reimbursed. So we know that their care is important. We know it has all sorts of benefits, and we want to make sure that doulas are able to serve those who need them the most and who may not be able to afford their services. So across the state, I think there's close to 27 states who are currently reimbursing. Many more states are actively on their way. New Mexico is now one of them. So starting last year, the New Mexico Medicaid began to create the benefit to be able to pay for doula services. This year, we've passed HB 214, which allowed that law to come into place, which is really allowing doulas to get that Medicaid reimbursement and set up all of the different parameters around how that's going to play out. So we're really excited again and really grateful for the New Mexico Doula Association and all of the advocates across the state who helped to get that bill to pass. So doula services are provided as preventative services. They have to be recommended by a physician or other licensed practitioner of the healing arts. Doulas are there to offer guidance to individuals who want to become pregnant and all the way up to 1 year postpartum. So we know that education is key and that the education provided by doulas helps to promote independence and advocacy for clients, whether they're giving birth in their home, in their community, or in different delivery settings. So the benefit that is covered here in the state of New Mexico includes the following doula services: prenatal and postpartum, physical, emotional, and evidence-based education support, as well as connecting folks to community-based resources, non-medical labor and delivery support. The doula benefit also holds the benefits of doulas working with clients through preconception, pregnancy loss, infant loss, and termination of pregnancy. So what this means is that a doula can provide services across the reproductive spectrum, which I think is just such an amazing and transformative thing here in New Mexico. Not all states are full spectrum, and so we really want to, again, lift up the advocacy that made this happen here. A lot of folks ask questions about the rates for doula services. So under the Doula Medicaid benefit, doulas can bill for the following. It's $25 for 1 unit, which equals 15 minutes. It's limited to 2 hours per day. So 2 hours would equal 8 units, and 9 2-hour visits per calendar year. So that means a doula is eligible to bill for 9 visits a year, up to 2 hours at a time. If a doula is needing, or if a client is needing additional visits, it is a possibility. It would require some additional documentation of medical necessity, and it would require previous approval through the MCOs and Health Care Authority. Outside of billing for visits, doulas are also able to bill for a $1,500 flat fee for labor and delivery. Now, these doula visits and this delivery fee don't have to be performed by one doula. A client can choose to have doula services for, preconception and prenatal care, and then also have a different doula for their labor and birth. We know sometimes, people have backups, and, we're going to be in one place and we end up having to call our backup to provide care. Different doulas can bill for the same client. They just can't bill for the same services. If you have questions about billing, reimbursement, or rates, you can direct them to the New Mexico Health Care Authority, which is also New Mexico Medicaid. Now, this is the pathway towards reimbursement. So if a doula in New Mexico wants to become eligible for Medicaid reimbursement, the first thing that they have to do is to gain training and experience through either a doula training program or through some sort of mentorship program or through just life experience. Doulas will then have to certify with the New Mexico Department of Health. Then they should obtain a National Provider Identification Number, or an NPI number. The next step is to enroll with the New Mexico Medicaid as a Medicaid provider, and then contract with the managed care organizations. When each of the above steps have been made, doulas can then begin to provide services and have those services be eligible for reimbursement. So we've had lots of questions that have come to us over the last 6 months as we began to roll this benefit out. And so doulas who live within 100 miles of the New Mexico border are eligible to apply for enrollment. So this is really great. This means that our doula friends over in Arizona, in Utah, in Colorado, Texas, all of these nearby neighboring states are able to become New Mexico certified doulas if they're within 100 miles of the border. And then, people have asked us if the application and the information about the program is going to be available in other languages. In the future phases of the program, we will have it available in other languages. At the moment, we are just able to provide it in English. So just to know that this is something that will be coming. Background checks is a big topic of conversation. So background checks will be implemented for doulas to become certified with the New Mexico Department of Health. However, at the exact time and moment, we do not have an exact date for you. So there's quite a lengthy process to get the background checks kind of up and running. And so in the meantime, we encourage doulas to still apply for certification and Medicaid provider enrollment. You can still become certified, you can still become enrolled with Medicaid, you can still begin to provide services and bill. As we get more information about the background checks, as we get that whole process going, we will reach out to doulas and let you know what the next steps will be. So please still apply. You can still get certified, as I said, and then we will provide more information about background checks in the future. Some of the questions have been around whether doulas have to get a referral in order to provide services. So yes, medical professionals have to refer for doula services in general, but do not have to list which specific doula is to provide care. So this is really important. Your client can ask their provider to refer them for doula services, and it can just be something very general. You as doulas can also, build relationships with medical professionals, and if they want to refer you specifically, that's great. But they don't have to, specifically name a doula in order for this service to still be able to be provided. Virtual services are not covered under this benefit. So all doula services have to be provided in person in order to be eligible for reimbursement. And as far as doulas having liability insurance, doulas do not need to have liability insurance for New Mexico Department of Health doula certification. They may need to have liability insurance in order to contract with certain MCOs. And so if you have questions about contracting with a specific MCO and you want to know which ones require liability insurance or not, that would be a question for each managed care organization. Overnight care is unfortunately not covered under this benefit. So this specifically will impact those doulas who are providing postpartum doula care. This was a question that came up in our last webinar together. And just to know that at this time, overnight care is not covered. So you will be able to bill for the 2-hour visit per client, per day, essentially 24 hours. So that's just something to know. And then something that's also really important is, doulas have asked us if they're able to charge their clients for services that are not covered by the benefit, and then also submit for reimbursement for other services. And it's really important for you to know that doulas who are seeking reimbursement for services are not allowed to also charge their clients. So you can't charge your clients for the other 22 hours of the day and then, bill for 2. It's kind of one or the other. So either you're, seeking the reimbursement or you're providing a fee for service for doula clients, but you can't do both, specifically per client. So we've had doulas reach out who work together as a team. So if you are working in a doula group, every doula has to become certified individually. So if you work with 5 people, each one of those 5 doulas would have to, create an account with the New Mexico Department of Health and then get their individual certification. As far as billing goes, again, any questions about enrollment and billing would go specifically to the Health Care Authority or to the MCOs. And we do have both of those folks on the call today, so that's really wonderful. Hopefully they can answer some of those questions. And then where can you find out more information about contracting with MCOs and billing? I'm really excited to share that there is a new toolkit which has been created through the collaborative effort of the MCOs, of the New Mexico Department of Health, and community organizations such as the New Mexico Breastfeeding Task Force, the New Mexico Doula Association. And this toolkit provides information on contracting and billing for both doulas and lactation care providers. So you're going to find information for both of those professions in the same toolkit. You will be able to find it on the New Mexico Breastfeeding Task Force website and the New Mexico Doula Association website. We're also going to be putting a link to it on the New Mexico Department of Health Doula Program website. And I'm going to have Melissa kind of share a little bit more in just a few minutes about where you're going to be able to find this toolkit on the NMDA site. Okay, so let's talk about becoming a certified doula with the New Mexico Department of Health. We've done so much learning and growing in the last 6 months. We've really kind of sat with and listened to you all and have worked through a lot of bugs, and just really am excited to share that this week we'll be launching our new online application system. And with that new application system, we're going to have some new updated doula requirements on how to become certified. And so, I'm really glad that you all are able to be here with us today so that I can share a little bit more about what this looks like. So information and applications can be accessed on the New Mexico Department of Health Maternal Health website. So if you go to NMDOH, Maternal Health, you will click on the Doula Program page. So this is what our Doula Program page looks like. You'll be able to find any forms you need. You can apply for doula certification here. You can find our toolkit, our list of frequently asked questions, as well as links to other important information, like the new MCO toolkit and the recently passed doula bill. When you click on the tab that says apply for doula certification, it's going to bring you to our new online application system. So this is what it's going to look like. It's going to give you an option to either log in as a first-time visitor or to log in through your account. So for those of you who have never, created an account with this system before, which is going to be, all of you at this point, you're going to go to the left, you're going to log in as a first-time visitor. It's going to provide you with different eligibility requirements once you've kind of entered into the system. And so here is the new application criteria. As I said, we've grown a lot, we've learned a lot, we've listened to you all, and we have shifted and lessened our application requirements. So previously, we were requesting that all doulas who apply for doula certification provide us with business license and CRS tax certificate and things of that sort. And we have removed those requirements. And so now all that doulas have to provide us with in order to become certified, they have to be at least 18 at the time the application is submitted. They have to provide us with a driver's license or other state issued identification card. They have to provide proof of current adult and infant CPR certification from the American Red Cross or the American Heart Association. And they have to provide attestation that the applicant has completed an approved or its equivalent HIPAA training. So these are the basic requirements that are necessary. I do want to make a special note here, which is that we've had a lot of doulas who will apply for their CPR certification and they complete only the online version and then turn that certification into us. And I usually have to reach back out to them to let them know that you have to complete both the online and the in-person trainings in order to become fully CPR certified. So just please make that note for yourself. If you're taking an in-person training and it has, both the training and the learning session together, that's, even better. In addition to the basic application criteria, each doula will choose their certification pathway. So they can choose pathway 1, which is that they have trained and certified in an identified doula training. Pathway 2 is where they've completed a doula training that meets the requirements for core competencies, and they provide the attestation that they've completed services to 3 clients. or pathway 3, which is that they provide 3 letters of recommendation, attesting that they have this competency to serve as a doula. And I'm going to kind of dive into each one of these pathways a little bit deeper here. So for applicants who have completed and certified in any of the doula trainings listed here, all you have to do is provide us with your doula training certification certificate, as well as some basic information about the training, the dates and things of that sort. And again, all of this information is listed in our website and in our toolkit. Pathway 2 is for doulas who didn't complete one of those trainings and might have completed a different training. And that training still provided all of the core competencies that doulas need in order to provide, good doula care, and then as well as providing attestation that they've served 3 doula clients. So if you've done Pathway 2, you would just fill out, the recommended you'd fill out the spaces where you tell us about, which training you took, provide us with your training certificate, and then provide us with the information about the doula services that you've provided. And then Pathway 3. So this is for doula applicants who, perhaps have had their experiences through either a cultural or professional or volunteer capacity, but did not go through an approved provider training that was listed in Pathway 1, and did not complete a training with the core competencies, which was listed in Pathway 2. So if you're somebody who's just had lots of experience, you've provided this kind of care in your community for a really long time, we still want you to be able to become Medicaid reimbursed. And so if that's the case, you're going to write or have 3 written testimonial letters attesting that you have, all the qualifications to be a doula. We have the templates for those testimonial letters on our New Mexico Department of Health website. 2 of those letters have to be written by a medical professional, a behavioral health provider, a nurse midwife, community midwife, an enrolled doula, or a community-based elder. And one of those letters has to be written by a former doula client. So just to kind of note that this is a small shift that, we weren't requiring doula clients in the past, but we are requiring that now. And then you have to be able to provide attestation that you've had doula services to 3 different clients. In the system, we do ask what kind of doula care we provided. And we've had conversations with folks and, they've shared like, I don't know if I feel comfortable, especially if it's a termination of pregnancy, letting you know about that piece. So if you feel uncomfortable letting us know the information about, who you provided doula care for, you can just let us know that information is available upon request. And there is a little area that you can check off in that case. Application processing. So applications are going to be processed within 30 days from the date of application submittal. So it'll take us about 30 days to kind of go over everything, make sure everything's in place. Many times it's happening sooner than that, but we give ourselves at least 30 days. The process to enroll with Medicaid and with each of the MCOs is separate and falls outside of that 30-day time frame. So Medicaid has its own time frame. The MCOs have their own time frame. So it's really important if you are planning to provide doula care to a client who's due, a month from now, just know that process may not all be completed by the time that client gives birth. So you really want to kind of build in your time frames in order to provide care to your clients and get reimbursed. If your application is missing any information or any forms, we will reach out to you. You'll have about 2 weeks from the date of the notification to provide that required information. Certification. So here we have another kind of shift in our former information. So any application that is submitted on our new online system after July 1st, so at this point, any application from here on out is going to have a 2-year certification period. Background checks are not being included as part of the eligibility requirements at this moment. but will be implemented in the future. So we will let you know again about background checks and any requirements about that. For the moment, all doulas will have a 2-year certification period. Any doula who's applied for certification between the dates of February 3rd and June 30th were given an initial 6-month certification period. I've contacted, I think, most of you. I know I still have a few more people to contact. And so if you're on the call today, you're going to hear this information. If not, I will be reaching out to you over the course of this week. So anybody who has already been certified between February and now will have their certification period extended. So as of July 1st, 2025, once I enter your application into our new system, you will have 2 years from that date for your certification period. So I feel excited about that, knowing that, for those of you who are kind of helping us in that early part of the system and getting all your paperwork in, you're going to have an additional 2 years to kind of complete your recertification requirements and just to kind of go through that. So that's wonderful. Okay, so that brings us to recertification. Eligibility requirements for all applicants who are looking to recertify. So this isn't really going to come into play for another couple of years. As I said, everyone's going to have 2 years to certify, but it is something to kind of keep in mind. So the eligibility requirements are pretty much the same as it was to certify. You have to be 18, you have to provide us with your ID, you have to have a current CPR certification, you have to complete your HIPAA training. Within 2 years, we have all our background check information, so background checks will be required at the renewal of credentialing. So just to know that that will be something to look towards as well. In addition to that, doulas will have to complete some CEUs in order to get recertified. And I did want to bring this up today because I do think it's important once you get your certification to start thinking about your CEUs. So 24 total hours of continuing education continuing education units are required for recertification. 12 of those hours have to be completed in the primary CEU topics with a minimum of 3 hours in each topic. And I'm going to go into that next. And then 12 hours have to be completed in the secondary CEU hour. So let's look at what that looks like. The primary CEU topics include maternal mental health, lactation support, prenatal and postpartum care for individuals experiencing substance use disorders, and racial bias and health disparities. So at least 12 CEUs have to fall within these categories. And as long as that, those classes, workshops, educational opportunities are within those general categories, and you receive CEUs for it, you're good to go. And if you ever have any questions about whether something would qualify, that's definitely something that you can reach out to us and we can kind of talk you through. So in addition to those 12 units, you have to have 12 additional units that would fall within the secondary CEU category. And I want to just say these are examples. So it's not an end-all be-all list. If you have something else that you feel really passionate about, if it falls within the general category of doula care or maternal health care, it would probably, be accepted. But again, please reach out to us. So some examples of secondary CEU categories could be perinatal care for Indigenous families, support for special birth circumstances, grief and loss, trauma-informed care, support for pregnancy termination. So you can kind of see that there is quite a variety of different types of classes that you can take or different types of workshops you can partake in. So this is looking forward to the next 2 years. And we have updated our toolkit. So if anybody's kind of looked through the toolkit in the past, just know that as of this week, we will have our updated toolkit on the New Mexico Doula page. It's going to have the new steps towards certification, the new requirements. It's going to take you step by step through our new application system, kind of show you, what each page looks like, what to enter, how to kind of go forward, troubleshooting, things of that sort, as well as providing you with important links on how to contact Health Care Authority, how to contact us, and then kind of provide you with all of that. Um, I'm going to stop there really quick because I know I said I'm going to do some questions later on, but I wanted to just see if there's any kind of burning questions about anything that I spoke about up until this moment. If there is, okay, Vicki, go ahead.
Hi, Jessica. Thanks for the thoroughness so far. There's three pathways, and there's a whole list of organizations that are listed under pathway one, training organizations. And how does one become a training organization listed as pathway one? I'm asking for the Yiyavi Kagindi doula training with Tewa Women United. Oh, sorry, I see us there.
You're on there. Yeah, thank
Sorry,
you.
I did not see. I went through and I was looking for Yiya and I missed Atewa. Thank you. That was an
No,
easy question to answer.
no worries. But let me tell you how this list is created. Um, Last year, we sat with the Perinatal Health Equity Coalition, and we kind of looked at, what are all the doula trainings that folks had seen in New Mexico that people were getting certified with. We also took the information that was collected through the Table Women United doula survey that was enacted in 2024, I believe, and looked at where doulas were being trained across the state. So they kind of self-identified trainings that they had trained and certified in. We took that entire list of trainings and, as well as the most common trainings that other states were certifying in, and then we created this list. So we know that not every doula training organization is on here, but we tried to be really thorough and kind of capture what most folks in New Mexico are training through.
Thank you.
Ours, yeah, and it does include our community-based doula training organization. So I feel really excited about that as well. Are there other questions at the moment?
Jessica, there's quite a few in the chat. I don't know if you want to check there or I can read them out.
Yeah. Is that Simran?
Yes, sorry. Hi.
Hey, Simran. Sure. That would be great.
Starts with, can referrals come from nurse practitioners and midwives? Like the doula
Yes,
referral.
they can.
Anyone else can chime in here. Sam is answering so many things.
Thanks, Sam.
Noelle said, so does that mean one can start completing CEUs now within the next 2 years so that when recertification comes up, you will have had that complete? Or what is the time frame requirement for when those CEUs were completed?
That's a great question. So once you become certified with the New Mexico Department of Health, your 2-year time frame begins. So once you receive your notice of certification, then you have 2 years from that date to complete the 24 hours of CEUs. So if you have not already gone through the process to get certified with us, your CEUs that you're currently taking won't count towards the recertification. You have to start afterwards.
I think that's it, unless I missed something, because Melissa and Sam are answering things so nicely.
Great. Okay. So
I'm gonna have one question just about the referrals, if you don't mind. What will that look like on the doula's end? Do we need to submit that in with our claim? And is that something that you're gonna go over later and I'm asking too early?
Yeah, that's a great question. And it's actually a question that would be more geared towards our folks over at Health Care Authority. So if April, if you are in, yeah.
This is April, and I'm here. So you should submit that with your claim, or keep it for your record. Really, you're not going to be sending it with a claim. You're not going to be sending it anywhere. The NMAC, our rules do cover that we do audit, and so we would expect to see those in that referral in your records. Otherwise, there could be recoupment.
Okay, great. Thank you so much.
Yep, you're welcome.
So let's talk a little bit about what happens after you become certified with New Mexico Department of Health. So you receive your certification letter, and then your next steps again would then be to go on and become a New Mexico Medicaid provider, and then to contract with the MCOs, provide care, and then submit for billing and reimbursement. So this is a little bit of a reiteration. You're going to obtain your NPI number. If you look at the Department of Health Doula toolkit, we do have a link in our toolkit where to get your NPI number. You'll then enroll as a Medicaid provider with New Mexico Health Care Authority. Again, we have a link to the Health Care Authority. It takes you to the Yes New Mexico site, and then they have their own toolkit from there that kind of will guide you step by step. They've also got a help desk that you can call, a 1-800 number that you can call to answer any questions about becoming a Medicaid provider. We do have April on the call today, so if you have specific questions, we can try and get those answered. And then if we aren't able to answer any questions about enrolling with Medicaid today, I will take down your list of questions and we will get those answers back to you through email. Once you become an authorized New Mexico Medicaid provider, you would then go on to credential and contract with the managed care organizations, and then be able to finally provide services, bill for services, receive reimbursement. I talked a little bit earlier about the toolkit. So the toolkit that we've helped to create here it's 2025 Doula and Lactation Provider Managed Care Reference Guide. That's a mouthful, but basically, this toolkit will help you to complete steps towards contracting with the MCOs for both doulas and lactation providers. Please excuse my typo. It's going to provide you with important links, contact information, things of that sort. Melissa, I'm going to bring you on here, if you don't mind, for the moment, just to kind of share with doulas where they can find that toolkit on the NMDA site, and then maybe you can talk a little bit about the doula passport as well.
Oh, cool. Thanks. Let me drop the link again. Thanks, Jessica. Thank you, everyone. We have uploaded the doula toolkit on our website right now. It's on nmdoula.org/resources. And so you can access it there. Download a copy, and then right below it there is a new NMDA full spectrum care access passport, and it's based off of passports that are used by other easy access clinics like Jetty Joseph's Common Sense Childbirth, but formatted and designed around the care being covered here in New Mexico. And so there's a print PDF, and then there's a digital fillable one. We also have hard copies if folks would like us to mail some to you. We can do that as well. You're welcome to share them and use them anywhere in community. Thank you so much.
Can I ask a question, Melissa? So the doula passport, I was really excited to see it because one of the kind of interesting loopholes in the doula Medicaid provider care piece is that because different doulas can provide care to the same client and bill, it's a little hard to know how many visits have been done within that calendar year, within that time frame. And so I really liked the idea of the doula passport because it helped the client to kind of keep track of who had been providing doula care. And is there anything else that we need to kind of know about that?
No, I don't think so. But that was definitely the point, right? It can also cover like if they're working with a community health worker, with a lactation support person. I saw an OBGYN in community when we were tabling this weekend and shared it with her, and they were thrilled as providers to have them to give to their clients, because also a lot of times they are hearing that like, oh yeah, I'm thinking about working with a doula, or like I I'm not sure, I saw this doula, but I don't remember who it was. And so being able to keep track of that on their person and have it with them, be able to share it with anyone that they need to or choose to. That's it.
Awesome. Thank you. Awesome. And then finally, I just want to give a moment here to talk about the New Mexico Credentialing Doula Advisory Council. So as part of the new law that has passed, HB 214, we have created this New Mexico Doula Credentialing Advisory Council, and we are currently accepting applications for it. We'll be taking applications through July 14th. So our deadline is almost coming up. That's going to be next week. This is a great opportunity for doulas and individuals across the state who are interested in providing advocacy, providing thoughts and ideas around and expert guidance around doula care in New Mexico. The Doula Credentialing Advisory Committee is also going to help to develop standards and requirements for doula credentialing in the state. We really want it to represent the voices of, our communities, of our doula communities. And we know that this credentialing council is also going to really help to support the doula workforce development. So please consider applying. The applications can be found on the New Mexico Department of Health Doula Program website. So again, we have about another week left. Once we get all of the applications and the timeline is closed, we will be letting folks know fairly quickly here, whether they were accepted into the credentialing council. And then our first credentialing council meeting is going to be in early August. And so, if you apply, just know that we're going to go ahead and get started right away. We're really excited about this. And yeah, we really hope to see your applications coming in. Okay. Now we're going to come back to the main gallery here and just provide a little bit more space to answer any questions that you all might have about doula certification, about Medicaid enrollment, or about contracting with the MCOs. So I just want to say, thank you to all of you for being with us here today. If you have any questions, this is my email, jessica.lujan@doh.nm.gov. I'm going to go ahead and stop sharing my screen here, and we'll come into the main gallery and to see if there's any questions. Does anyone have any questions specifically about today's presentation? Savannah.
Hi, thank you for your presentation. I was wondering about the whole 2 hours per day thing. I just want some clarity on that. If anyone could speak a little more, because it seems like 9 2-hour visits doesn't seem like that much. But yeah, thank you.
Yeah. What is your question specifically? Like, is it possible to extend more, or why was it 2 hours, or what would it, I want to answer specifically what you're hoping to know more about.
Yeah. Why is it specifically 2 hours?
Okay, that's a good question. I'm going to pass that over to April.
So we actually had a work group and actually kind of built a benefit plan. And so this is kind of what we came out of that work group. And we can look at it obviously and make changes accordingly if we, and take that up leadership and see if that's something that we could do right now. But the way it's set up right now is something that we can't change.
Thank you.
Yeah. And if you have anything, or you can email me, and I'll put my email in the chat box, and you can email me something supportive, something to that I can take up to leadership. I can tell you that probably right now is probably we're probably not going to have any changes right now. We see what the, rollout comes out of this.
Thank you. Yeah,
Mhm.
it takes a while, right, to get all of this kind of rolling and in place. And it took so much work to get us to just the place where we've got the benefit happening. We've got people being able to contract with MCOs and get certified. And so just to know that we thank everybody for your patience ahead of time, because we do take all of your suggestions and comments to heart, and we, are keeping note of everything. We can't guarantee that they're all going to happen, but we definitely, are taking it into consideration, and we'll work towards meeting, the goals of the Doula Credentialing Council. If you feel strongly about having a voice at what this looks like, please consider, again, applying for the Credentialing Council, because that's where we're going to kind of talk about all of this benefit and how it rolls out into the future.
Yeah.
Yeah. What other questions do we have? So somebody was asking if we are going to do the recording of the meeting. We do have the recording of the meeting. For those of you who missed the first part, it may come in 2 sections because my computer stopped recording and Tashi's picked it up. So we will have 2 versions of this meeting. Okay, I see 2 people raising their hands. Feel free to go ahead and ask your question. Matt.
Thank you, Jessica. My name is Matt Gallegos, and I am Chief Operations Officer with Mecca Therapies. And my question has more to do with group Medicaid enrollment. You had said there were some people on from Medicaid and HCA earlier, so I'm hoping I can kind of get some guidance. We have been applying for a group Medicaid number and are running into some challenges with the taxonomy crosswalk provided to the Yes New Mexico side of things from HCA is requiring a group certification. Now, my understanding is that doesn't exist. There needs to be individual certifications for the providers that are going to be affiliated with our group Medicaid number. But because the crosswalk provided by HCA is requesting the group certification, our application is being denied. We've escalated this both with Yes New Mexico and HCA and have yet to have a solution. So I was just wondering if someone could provide me some guidance.
Thank you. I'm going to refer to April and to Sam about that.
Yeah, so I don't think that Wes is on the call here. But if you
Hey, April, I'm here.
Oh, hey, you made it.
Hey,
Okay,
yes,
there's
I
Wes.
was
He
able
can
to.
answer your question. I hope.
So yes, as a group, you will need to have an affiliate for these CHWs. So as a CHW can enroll as an individual, but you will need to affiliate the individual with a group.
Right, but we have to have a Medicaid number and that we need to affiliate the individual provider with.
Yes.
And our application for a group provider is being denied because the crosswalk provided to Yes New Mexico requires a group certification, and there's no such thing as a group certification.
Okay, maybe you and I can chat about this offline.
Okay.
There has been a new matrix that has been updated and sent out. So as recent as of yesterday.
Okay.
So maybe we can take a look at that.
Maybe
and
that will take care. I know, well, and this is on the doula side. We had the same issue with CHW,
yeah, and the
but that
CHW
was
taxonomy
corrected
has.
and our application was approved.
Okay,
However, the
great.
doula has not gone through yet.
Okay. All right, and we can definitely look at that. Let me drop my name and email in the chat, and if you want to send it over to me in April, we can definitely take a look at that. Okay.
Awesome. And I have some of my staff that have been working on it. So what I can do is share your information with them and then have them reach out to you to see if we can't work
Absolutely.
through the process.
Absolutely.
Thank you.
Thank you.
I also know, Wesley, hang on, because I know that Simran had some questions about group billing as well. So I want to pull you in, Simran.
Thanks, Jessica. Honestly, these were exactly the same questions I had. I was concerned about having a doula co-op and going through the NMDOH application because it's really specified for individuals. But Melissa answered that in the chat. It sounds like the group really doesn't need to be certified through DOH because that's for the individual. And then we will work on the AHCA side. So this is helpful, and Matt's question just now is also useful. Thanks.
Great, awesome. And Simran, if you can just, Wesley put his email in the chat. I think that's a go-to email for you if you have questions about group billing going forward.
Perfect. Wes, I'll be in touch, I'm sure.
Wonderful. I see another question, another hand raised, but I'm not sure who it is.
Hi, Noelle. Sorry if you covered this. I missed some of the beginning, but how would the time limits and reimbursement rates apply to termination care or miscarriage and things that aren't, in that category?
Are you asking about like billing for individual visits? Are you asking about can you be a little bit more specific, and then we'll get you a more specific answer?
What I remember from that slide, like getting back to the 2-hour visits being a limit, and then the $1,500 reimbursement for a birth.
Mm-hmm.
But is there an equivalent to if you were accompanying someone to abortion or through miscarriage?
Right, that's a good question. April, I'm going to refer to you for that. So I
put in the chat, I put the table that with the rates in there. And you can see that for the pregnancy loss, infant loss, termination of pregnancy, it tells you which diagnosis code to use, and you would use a U2 modifier using the procedure code T1032. And so it is $25 a unit, and however many units you use, a max of 2 hours as one visit.
So what I'm understanding, Noelle, is that, although there is a $1,500 flat fee for labor and birth, there is nothing equivalent to that for termination of pregnancy or for miscarriage support or loss support. You would just bill for visits either before or after the procedure or the event takes place.
Correct. And your visit can be up to 2 hours.
Mm-hmm.
And that full spectrum visit would deduct from the 9 visits that client gets in a calendar year, which is why we like the passport, because perhaps someone has seen someone for a miscarriage or loss, and then they get pregnant again and they seek out doula services. They can continue to monitor that because they get 9 visits per calendar year that have been authorized regardless of what the service was.
Got it. Thank you. So that means if you were to accompany someone for a full day going into a clinic, you would only be able to bill for 2 hours. Is that correct? And yeah, okay. Thank you.
It is. And, I think that as a doula and, having kind of sat through all of the conversations that have kind of led us to this point, I think that there's a lot that we're learning, right? There's a lot we're learning about doula care and about the needs of doulas and billing and reimbursement and all of that. So some of the pieces around like postpartum support, like overnight care, accompanying a client to termination of pregnancy or being with somebody, to support a miscarriage or a loss, like it does take more than 2 hours. So again, I would say please apply for the Doula Council. Thank you. I'm not sure who put that in the chat, but it's really important because your voices are what is going to make the difference going forward. And so if you're passionate about termination of pregnancy services, we really want to hear what you have to say.
Thank you.
Yeah. Are there other questions? I see lots of folks in here. I want to make sure to answer all of the questions that we've got for you or that you've got for us. Anything around Medicaid, MCO contracting. I did see a question in here actually, just to bounce back here. I'm not sure if I got answered. Brandy was asking about is it preferred to register for a business license as well? So I'm not sure, Brandy, if you are asking about getting certified with NMDOH. Although we were requiring business licenses between February and June, as of July 1st, we are no longer requiring that. So you do not need a business license. You do not need a CRS tax form. You do not need your EIN number in order to become certified. You just need your training credentials. So that includes CPR certification, your doula training or experience credentials, HIPAA credentials, things of that sort. So I hope that that answers your question. Are there any other questions? We are doing great on our time, which is wonderful. And I love to give people more hours to their day, but I definitely want to also give space in case any of you had questions about anything here. Where can you access the doula? Okay, so thank you, Melissa. Answered the question about the doula passport.
I do have a question. And just to reiterate, it's 9 visits per calendar year, not per pregnancy, correct?
Per calendar year, yeah.
Oh, perfect. Thank you.
You're welcome. So I know one of the questions that came up in the last webinar was, what happens when the calendar year goes into the next calendar year? So if you're working with a client who you start working with them in August and they're not due until March, does it start all over again in 2026, for example? April, what is the answer on that?
It's per calendar year, so it starts all over in January again.
So,
oh, somebody finally gave me a heart. Thank you.
So just to note that, folks, every year it starts fresh. So even for the same clients. Another question that kind of came up, I'm going to just answer some of my own questions. Can two doulas bill for the same client for the same service? I'll pass that over to April.
So they're not at the same time.
Not at the same time. So if I'm working with a co-doula and we both show up to support a client for birth, only one of us can bill for that birth. Correct. So for all of you doulas who are co-doulaing, that's something just to keep in mind. One of you can bill and then you can work it out between the two of you. Are there any other questions about billing or enrollment or certification?
I have a question about the Medicaid side of things, and I don't know if this is the right place to ask, so you can direct me if not. But I was one of the ones that was previously certified through the DOH, so I've already started kind of trying to work with the MCOs.
Mm-hmm.
And I've run into a little bit of a problem, and it might be updated now, and I haven't checked back around, that because doulas are non-medical providers, some of the forms and things that we kind of have to fill out to work with these MCOs aren't really geared towards us. So a lot of times, we get kicked back and then we're just kind of lost in translation, I guess.
That's true. That's true. And there are some loops in the system and things of that sort. We're really hoping that the toolkit is going to be helpful for helping some of you. April, I saw you unmuted, and so I definitely want to give you the opportunity to answer that as well.
So are you saying that you don't know if you're credentialed yet, or was there a barrier of some kind, like some sort of form?
So I was able to successfully credential with Presbyterian, and I'm still waiting on a couple other ones. But Blue Cross Blue Shield was one that I've had trouble getting my full credentialing done with. I think that they use the CAQH system or something. And I've had a little bit of difficulty with that one as well, just because it's the same for lack of a better term, kind of issue, is that it wants to know about board certifications and all these things that are more geared towards medical providers.
Right. I do know that I went online because I heard that, and I just took that, went and looked for the instructions on how to fill that out. And there was an affidavit in there about, or a line saying that if you don't have insurance to gave you a second choice instead of clicking on any of the insurance stuff, that you would move on to the next one that said, I think it says something like, oh, that if you don't, when you have to obviously have to check no insurance, right? And so you would check the no insurance, but then it tells you to write something on a letterhead. So I think write in its instructions, and I just pulled it up online because I wasn't familiar with it. And so I just pulled it up off online and looked at the instructions. It was real, and they even had pictures and everything. So it was pretty nice instructions. So maybe try that and see if it doesn't work. But I'll also follow up with our MCOs. And it's for the insurance, the liability insurance, right?
No, I have the liability insurance and all of that. It's mostly just filling out all of the forms that come along with credentialing and things like that. I've been able to get through most of it, but sometimes I've even had to work directly with the MCOs, and they kind of on their end of the system just click something that's not really applicable to me, like, oh, they just click midwife, and then they go in and put in a note, hey, she's a doula, like, and they fix, I mean, I think they fix it in the long term, but it's kind of, you have to get past the automated system, I guess, if that makes sense.
Right. Jessica, wasn't there like a walkthrough with a couple of providers, like walking them through the whole?
So I think that like Blue Cross Blue Shield is one of the places where folks are getting a little caught up. So I know that there's a question here if there's anyone from Blue Cross Blue Shield. Stephanie Behill says, yes, I'm online. I'm taking your concerns and comments. I will take it back to our contracting and credentialing teams. Please send me your contact info and I will get a response. Stephanie, if you could put your email in the chat, I'm sure you will have lots of doulas reaching out to you who are trying to navigate Blue Cross Blue Shield. I also want to just take note that Melissa shared the contact info for Luminar Health. I know Luminar Health New Mexico has gotten a grant and is supporting doulas in the contracting process with the MCOs. And my understanding is there's no cost to doulas to do that. So hopefully I'm not speaking out of turn. But those are some contacts for you all who are wanting to get contracted and are having some challenges. Wendelin, I saw a question from you in the chat asking if are we able to apply as an organization or does it have to be as an individual? I think you're asking about the Doula Credentialing Council. Is that correct? I'm not sure if you're still here.
Yes, I think she said yes.
Okay, great. No, so because of the way that the law was written, it's really specific on who is in the Doula Credentialing Council, how many people can be on it. So the Doula Credentialing Council will include a representative from the Health Care Authority, from the New Mexico Department of Health, a representative from ECECD, as well as 12 additional members. Of those 12 members, 8 of them have to be doulas, so practicing doulas here in the state of New Mexico. So we're only able to bring in 12 additional people on that Doula Credentialing Council. So if you're interested in applying, it is done individually. We're not able to accept organizations or anything of that sort. So it is that. And we're looking at like the terms and things of that sort. That's something that will be decided by the council and our initial meeting, which I think, Tashi, we said August 14th is the initial Doula Credentialing Council meeting. Is that correct?
Actually, it's August 12th.
August 12th. Thank you. Awesome. Okay. So, Tiffany, do you have any specific questions that you want to ask, or are you going to just reach out to Stephanie?
To reach out with Stephanie, that has been a problem with at least my journey with Blue Cross Blue Shield, is I have not been able to get my hands on an actual person. They loop me from the phone number to the website, and the website leads me back to the phone number. And so it's this, like the song that never ends, So this is perfect. I'm so glad I got Stephanie's contact information, because I'm sure we can make a lot of changes, because when it comes to the group credentialing through Blue Cross Blue Shield, when they ask for that category of what are your services, what are you providing, they want to know who you are or what you do. There's no doula in there. There's not, and there's an asterisk. You have to put something. So I just put telehealth. I had no idea what to put. But now I know we can't do telehealth. So, I mean, there was even homemaker in there, but there was no doula. But there is doula if you're providing for like if you're doing single credentialing, there is doula. But for the group setting, there's no doula on there. So maybe if we can bring that back to Blue Cross Blue Shield to add that.
Thank you. All of these little things help us, right? Like, it's a new benefit, never been done in New Mexico before. We're trying to fit this new benefit into like old systems and trying to make it work. And there's just little things that come up and we're like, oh, look at that. So thank you. That's helpful. If anybody else has anything like that you want to share with us, you can do that through my email. You can contact April. You can contact the MCOs individually. Those are all really great ways for us to learn how to make this benefit more efficient, easier for you. We want you to do this, right? We want you to get Medicaid reimbursed. We want you to start providing these services. This is really so that you all can do this work, this heart work that you have chosen to do, and continue to make such a beautiful impact on our New Mexico families. So I really appreciate your patience as we kind of navigate all of the learning together. Okay, I see another question. I'm not sure who it is. If you have your hand raised.
Hey, sorry, it's Melissa.
That's okay.
Sorry. There was a question raised earlier in the chat. I'm not sure who raised it, but I think we passed it, and I just want to go back. It's about the federal dollars in Medicaid and, this new benefit. Is there any updates or worries or, ideas around any changes that are coming and the stability of this benefit in this moment, which I know is not an easy question to answer?
Yeah, correct. So, I mean, it is part of our state plan amendment. It's already been approved, and it is, we do have instructions out, and we plan on putting it in our NMAC, and we don't have anything else at this point.
Thank you. That was my question. I do have another question about credentialing. To my understanding, you said you don't have to have a certification for like the stage 2 or 3. You don't have to have a certification to like a doula certification to get to apply.
Right. So if you're
I understand that.
I do, yeah. If you're applying through Pathway 3 for New Mexico Department of Health doula certification, Pathway 3 is for those individuals who have had a lot of experience in doula care. Let's say you're an indigenous doula, or if you're a traditional doula, you've been providing doula care in your community, but you didn't take one of the specified doula trainings, or you didn't take a doula training that has met those core competencies, but you've got all the experience, you can still get certified. But you do have to have 3 letters of recommendation, and you do have to provide attestation that you've provided doula care in the last 2 years prior to applying for certification.
Okay, thank you. And for my CE or CEUs, would I just have to go through that process again?
Right. So yeah, that's a good question too. So let's say you certify with Department of Health through Pathway 3, and then you have 2 years. You still have to take the CEUs. You still have to complete that requirement in order to get recertified. And so it kind of is the same regardless of which pathway you're choosing.
Okay, thank you.
Okay, I see that there is Janelle has given their contact information in the chat from Presbyterian. So if you're looking for contact info from Presbyterian, please look to the chat. It's also listed in the MCO toolkit. We've got some contact info in the MCO toolkit, which is on the NMDA website. So please take a peek at that toolkit as well. And hopefully it's really going to help folks to kind of meet those step-by-step requirements to get contracted. Okay, are there any other questions? All right, everybody. I love giving people time back in their day. I know some folks had to leave a little early. I know some people had kind of held this whole time frame, but now hopefully you can do something good for yourself. Go get out in the sun and breathe some good clean air out there. And yeah, just thank you, everyone. Thank you for being on this call with us today, taking the time, asking your questions. I'm going to put my email in the chat. So you can definitely reach out to me if you have any questions about certification. I'm going to have Tashi put her email in the chat as well. I can't talk for some reason and type at the same time, but there we go. So Tashi, if you can put your email in there as well if folks have any questions. Otherwise, I really look forward to getting your applications in. As I said, we're looking for a launch of July 14th for our online application system. So starting July 14th, you're going to be able to apply for doula certification with the New Mexico Department of Health. Over the course of this week, we're going to be adding our new toolkit. We're going to be putting the recording for this presentation on today. I will be sending out the recording to you all as well, to anybody who's registered. And yeah, we really, again, appreciate it. Thank you for taking the time of, the last hour or so with us today. Thank you.
Thank you. Thanks, Jessica. That was awesome.